Millie Blount and her husband Steve spend this sunny day four-wheeling, a favorite pastime of theirs.
It's just because of where we live, it's just part of us. And our grandchildren really like to come and ride four-wheelers.
Millie appreciates these happy moments because there was a time not so long ago when she wasn't quite sure which way her life was headed.
It just showed up as a sore spot, a tender spot on my breast. And, I kept on saying to my husband, this really hurts here. And I had him feel it.
My daughter and me, we would both, sort of encourage her, well, maybe need to get it checked.
So I went a little longer and they pushed me to go get it checked.
When Millie presented for her mammogram, she had a palpable mass. And by palpable mass means she could feel something in her breast.
They did the mammogram, they came out and they said, we need to do an ultrasound.
An ultrasound led to a biopsy.
In your mind, you're wondering what's going on, that it has to be continued to be investigated.
They did the biopsy. And it came back as stage 2 breast cancer.
You never forget getting that phone call that says, Mr. Blount, I just want to let you know that your wife has cancer. Sort of as a bombshell.
The metallic BB on the skin surface marks the area that she could feel. And this area under the skin, this brighter, whiter area, is the area of the tumor. So you can see it's a little bit more dense than the adjacent breast tissue.
You hear all the horrible things of cancer and what it does and the results. And what does that put in front of us?
Most women, depending on the size of the tumor, have the option to keep their breast and have a lumpectomy, which means just removing their cancer, or have a bilateral mastectomy, or even a unilateral mastectomy.
We decided, okay, this is a no-brainer. Let's just lessen my chances of breast cancer coming back and do a bilateral mastectomy. It was not an easy decision to make because, as sad as to say, your breasts are a big part of who you are.
Along with that decision, Millie chose to have reconstruction.
If they're opting to have reconstruction, it's a surgery that we coordinate with our plastic surgeons, so that way they're in the operating room at the same time we are. That way when we remove the breast, they're able to start the immediate reconstruction at that same surgery.
The first time I met Millie, we discussed about the options, and we mostly entertained doing an abdominally based free flap for reconstruction of both her breasts.
They talked about hours of surgery. Could be 18 hours of surgery.
A free flap is basically where we remove the tissue from the abdomen, much like in a tummy tuck, but along with its artery and vein. And in her case, we were able to remove that tissue without actually removing any of her muscle underneath, so it completely preserved her muscle function of her belly. That tissue was then transferred from the abdomen into her chest wound after the breast surgeon had removed both breasts, and then we rehooked up the blood supply and molded that tissue into a breast for her.
The doctor came down to see me. The doctor was confident that it was a good surgery.
It was a 14-hour surgery. I don't remember much from leaving Steve behind and waking up the next day in the ICU.
The first step on her road to recovery.
I have not let it define who I am. I am going to come out a winner, and that is because of my faith and my family and friends.
She's doing good. She's recovered fully, able to resume all of her normal activities, being able to ride on four-wheelers, have fun with the grandkids.
Every day I look at my mirror and I have this Bible verse. I can do all things through him who strengthens me. And I believe that gives me the strength to get through my day.